breast has to be examined with the left hand. Your arm is up, right? So arm is up. Now let's suppose examining your left breast. You see 3 fingers, the bulk of them, and gently right from collarbone onwards, you have to examine. 25 paisa point, do that circular motion all over the breast like this, right? Now then form small pressure, then firm pressure, more firm pressure, go till the bone, because that bone is a breast tissue. ऊपर से करके you will just going to the skin and the subcutaneous tissue. You have to examine the whole breast, and once you do, you will find, oh, there is a lump here. This is how you feel, and you can see that there is a lump. Now in the end, you have to come to the areola area and gently do the same circular mesh motion. Then in the end, express the nipple to see if any discharge is near. Definitely, if you have a problem, there will be a milky discharge. There will be a milky discharge, fluid discharge, or any other discharge. But all discharges are not problematic. You have to work up. You know, suppose milk is coming in a young girl, prolactin levels have to be done. Maybe she is having erythrolia, which can be because of PCOD. So there are many hormonal imbalances, especially high prolactins, which is causing milky discharge. But we have to work up. We can't ignore it. Okay, this milk is coming in young girls or a fluid is coming. It's normal. You have to show your gynec shield, do all the workup to find out what is the reason for the discharge.